question. Okay. Considering it, if you've read and understood, considering it critical care scenario, please tell me, how would you manage this patient now?
Okay. So I will manage this patient according to the advanced trauma life support protocol. So I will go
Okay.
through the A, B, C, D, E, airway, breathing, and circulation. So I will airway plus cervical spine immobilization. I
Yes.
will talk to the patient. Is he able to talk? Then the airway is patent. If not, then I have to look for any foreign body like bleeding, tooth, or any other foreign body. I
Yes.
have to remove it. Then I have to fix the cervical spine with the heart collar. If the heart collar is not available, then maybe I will go through the sand bag and tape.
Yes.
And then I will go for definitive airway. Like if the patient is having any sound like any stridor or something, then we have to give maybe either a good well airway, or if is still not, we will do chin lift jaw thrust. Then I will put a good well airway. Then maybe we can put nasal cannula or maybe non-breathable face
Okay.
mask
When
and
you,
oxygen.
sorry, I have to interrupt you. Once you're inspecting the oral cavity of the patient, you suspect that there is a foreign cavity, foreign body in the oral cavity. How would you take that out?
So either we will use McGill forceps, or if it's possible to just use the hand. If
Okay.
not, then maybe I will use the McGill forceps with the help of that.
What other
And
measures can you take? Okay, one attempt is you have taken. If it's not possible to remove it, how would you help or ease the patient in taking the airway or opening the airway?
if it's not possible, then either we can do a cricothyroidotomy
Very
or
good.
tracheostomy.
Yes, very good. Or you can even go for endotracheal intubation or
Yes,
yeah. All right, good. Okay, so, then for
then I
breathing,
will go for breathing. So I
yes,
will check the breathing pattern. Is it irregular or is it asymmetric? Then we have to look for respiratory rate, then chest expansion, and the
yes,
tracheal position. Is it deviate to opposite side or not?
yes.
Then I will put on the monitor to check the saturation, and of course we will have to put a oxygen via either a nasal prone or maybe non-breather face mask. Then, if it's possible, we'll look for sign symptom of any tension pneumothorax. So, if
All
it's
the
there, then
symptoms.
we have
Yes.
to go for.
All right. If you have done in one imaging, what kind of imaging is that in front of you?
So, this one seems like a plain X-ray of neck lateral
Okay.
view.
Yes. What can you see?
So, the cervical C6 and C7
Yes.
fracture
Yes.
with compression of spinal cord.
All
Is
right.
unstable fracture.
This is another imaging that you've done.
Yes.
Please
So
read
this
it
is
from me.
a plain X-ray of chest AP view,
Yes.
which showing a left-sided pneumothorax
Yes.
with surgical emphysema and
Yes.
obliteration of left costophrenic angle.
Okay. Do you see any rib fractures or not?
The image is not very clear,
Very
so
good.
maybe some refracture is there, but it's not
Yes.
visible.
All right. Tell me, how should this be managed?
So this patient, if is like not a proper settings, we have to do a needle thoracostomy on fifth intercostal space. Or
Yes.
if we have a well-equipped hospital in emergency settings, we can do a intercostal chest tube drain
Very
in
good.
the fifth intercostal space on the mid clavicular line.
All right. You've done that. You've inserted the chest tube insertion you've done. Now patient has gone into shock. What type of shock do you expect to see and how would you manage that?
Okay, so the patient might have a hypovolemic shock, or
Good.
could be a neurogenic shock, or maybe a cardiogenic shock.
Okay. And then how would you manage it?
So, of course, for any kind of trauma, our first suspicion will be a hemorrhagic shock. So, we
Yes.
have to start open two wide bore cannula and start crystalloid fluid according to the weight of the patient. So, we'll start 20 ml per kg body weight and in divided food dose. So, we will start first dose over 15 minutes. If it's not respond, then I will repeat it 4 times. So if it is still not respond, by this time we have to send for blood for FBC, ABG, and cross match and ask the lab to prepare 4 units of blood. Then we will start blood transfusion. If it is still not improving, then we might start epinephrine, norepinephrine, and then we will consult with the ITU specialist.
Okay. Please tell me what other criteria you have to consider for the assessment of patient while
So
patient is undergoing
we'll
through shock.
monitor the patient blood pressure, pulse, urine output, capillary refill, and mental status.
Yes. Respiratory rate as well and
Yes.
urine output and mental status. All right. How would you measure or assess mental status of the patient or the
So we'll use
response?
Glasgow Coma scale.
Yes.
So we have to look for eye opening, verbal response, and motor response.
Good.
So if it's less than 15, then we will consider the patient is having altered mental state.
All right. Considering this scenario, how would you categorize the level of shock of this patient?
Uh, so this patient, as there is no obvious bleeding, only the foot fracture and this clavicular fracture, multiple rib fracture. And so I will consider is class 1 or 2.
Between 1 and
Although
2.
vitals are
Okay.
stable, yes, ma'am. Yeah, either class 2 or class 3, maybe.
All right. How do you think, okay, how much blood loss patient would have suffered or
Okay,
patient
so
is
if the patient is having like more than 1500 to 2 liter of blood loss, then patient vital will be changed, like BP will decrease. But in class 1 and class 2, the BP will be normal. And of course, pulse will increase, and then urine output will be low,
okay? In order to
and the
manage,
mental status also low in class
yes,
3 and upward shocks.
yes, good. Right. How does it affect urinary output?
Okay,
The
so for
shock.
class 1 will be more than 30 to 40 ml per hour, and class 2 it will be 20 to 30 ml, and class 3 will be less than 15 to 15 to 5, and class 4 maybe anuric or less than 5 ml per kg body
Right.
weight per hour.
Okay, good. Right. In order to manage in order to manage or recover from the blood loss, you thought of giving crystalloid solution to the patient. What else can you give or
So as
suggest?
we said about, we have to send the blood for FBC cross match and ask the
Yes,
lab to prepare at least 4 units of blood. So
yes,
if the we can see the FBC, if the HB is less than 9, then we start blood transfusion.
right.
So we can give either a full blood or maybe FFP.
All right. Okay. Yes. Good. That was my next question. Right. Thank you. Good, excellent.